Do you have memory changes, cardiovascular disease, or maybe just are super interested in longevity? Then you absolutely need to have your lead tested. Hi, welcome. Thanks for joining me. I'm Dr. Angela Jaeggli of Sage Health TV. So today I want to talk to you about heavy metals. It has been a passion of mine for many years. Even as a young med student, I would see the studies on, the treatment of heavy metals and the amazing outcomes for cardiovascular risk and diabetes in the brain. And I was just like, this stuff is like fascinating. It's blowing my mind. And so I've been a big advocate of testing heavy metals and educating people about them. And that's what I'd like to do for you today. So what are heavy metals? Heavy metals are like lead, arsenic, mercury, uranium, cadmium, and it goes on and on and on. There are many. But most people don't know. They hear about them, or maybe they know about them if they have mercury like in their mouth, but they don't really know why. Why are they bad? Why should they be avoided, or why do you want them out of your body? So most people have exposure, pretty much everybody. So if you have, again, mercury fillings, or many times our city water is slightly contaminated because they only have to reach like a level, and sometimes it goes over and they don't really share that with you until after it's corrected. I just had a patient actually find metals in her filtered water that was supposed to be guaranteed. It's in foods. So a lot of times I'll hear from people maybe that have risk, or again, if they're just looking at prevention, they're like, I don't know if I want to get this tested because I don't think I really have any heavy metals. And that is absolutely not true. We all have heavy metals. So I just want to make that point. You have heavy metals right now in your body. It's basically just a factor of how much do you have? And also, what are your risk factors, around that? Because some people are better detoxifiers than others. And that comes back to genetics and your diet and how much you're sweating and exercising and all those things. So anyway, let's jump into, what heavy metals do exactly. So if we're talking about first, cardiovascular risk. Let's think of a metal. So it's very, very strong. Think of it as a Pac-Man, right? So whenever we ingest something or we're exposed to something over time, again, whether your mercury fillings are leaking or you have lead in your water, it's going to go to, let's look at the artery. So this is an artery, right? This is plaque. And so what a heavy metal does basically is it comes in into right here. If we think of, this is going to be my Pac-Man, although it looks like a moon. It gets right here and it starts picking away at the lining of the artery. And so what happens there? Essentially, we start getting this. We start as the body in response. So people always think of plaque as a really bad thing. It's not great, but it's actually our body's healing response to damage. And so as we go along, now this could be other free radicals in addition to metals, chemicals, or, other things. But over time, we start getting this buildup. And that's when people talk about stiffening or hardening of the arteries. This is what we're seeing. You start seeing this lining kind of thicken up, right? So essentially, heavy metals are an extreme, they drive that process. And in fact, in studies where they've done biopsies of the linings, you'll find mercury and lead inside the lining here. And so that's not great, but kind of the cool thing is when we start treating it, it actually gets pulled out. It starts pulling out in addition, and all of this starts changing, which is pretty cool. So when we think about these are arteries, all over your body, including your brain, right? So it's impacting your brain, but it's also, they're impacting your brain in a different way. What we see is it's starting to, it impacts the brain. We can look here. So number one, we're looking at killing brain cells. So essentially all metals are neurotoxins. And you can really see that very, very well whenever somebody has a huge dose of something, like the whole Michigan event where tons of lead, and they were starting to see actually cognitive changes in children. But you can see that in adults too. That's not just limited to children. It literally starts, if we think about, we have a brain cell here, it starts destroying this lining. And as we know about neurons or the brain, that we can repair this actually, but you're not getting any new, you're not getting new brain cells. Like, this is what you've got is what you've got. So we really want to protect this. And luckily, again, we can pull these things out. We can pull metals out. Again, this looks like a fried egg. It's a neuron. So the second thing is that it changes memory. So like, I'll have people come in, and actually Dr. Mark Hyman, who a lot of people really know, had mercury poisoning, and one of the first things he started noticing is he couldn't remember. He's a very smart man, very smart doctor, produces lots of content, books. He couldn't remember things, and he started feeling very fuzzy, and started having other symptoms too that we see, which is numbness and tingling. It starts messing with your motor skills as well, and that can also be common, and that's mercury and lead and arsenic actually. So mood, here we're talking about mood. What's really interesting is that lead in particular will actually go in and start behaving like one of the communication signals within the brain. So our cells talk to each other, and that's how that's how it's actually like our brain neurotransmitters affect. They go on to the cell. We have a brain cell. Here's our little receptor. Your dopamine comes along and binds, right? Comes over, and you think like, yay, I'm happy. I feel good. Actually, lead inhibits that. It will bind, and you don't get that effect anymore. And what that ends up resulting in is aggression. Actually, really strong studies, level of crime, and amount of lead in the water in cities. And that can come across in children too that have behavior issues. As well as actually really low mood, depression, sadness. Again, you're losing your happiness. Dopamine's our happiness molecule. So if you don't have that impact, it's gonna affect you. But dopamine also affects the memory as well. So IQ, we're talking here about IQ, and then changing executive function. So children especially, they can actually lose significant amount or level of IQ. But also you see, this is where people start thinking like, oh, I'm just getting older. Like, oh, I can't multitask, although multitasking isn't that great. But, let's say like I used to be able to do all these things, and now I can't. I can't. Or I used to be able to kind of, maybe perform something at work, and they're like, I'm having a really hard time with that now. That's an executive function. So if you're having any of these things, don't just assume that it's normal aging. Really the way I look at it, there is no, quote, normal aging. It's like there are things that's getting back into anti-aging and longevity. We can always work to improve our bodies and our brain, no matter what age you are. So I will just talk a little bit about, so what do you do? So you're like, okay, I've either got a condition, already that is inflammatory, like diabetes or hypertension or high blood pressure, or, I know I have narrowed arteries. So first you want to get tested. That can be done through your regular lab like Quest. I prefer a more extensive panel, and I prefer it to be chelated. And what that means is I give you the actual treatment, we pull things out, and we can see then what your body burden is. Like, what have you accumulated over years compared to like if you just take a single sample without doing that, you only see really what you're being exposed to in the last week. So I prefer that extended test. It's pretty inexpensive. It's about $125, excuse me. I don't need that anymore anyway. And so treatment's really extensive. Like, it really is individual. It's what you can tolerate. We get into natural things like organic chlorella, cilantro, but then, sometimes a little more aggressive, like IV EDTA. And a lot of the studies are based on that particular one, but there's DMPS and DMSA. So I'll wrap this up because the treatment part actually is a whole other segment, which I will be bringing to you as well in the future. But if you have any questions about this, or just curious about your risk, please reach out to me. I love answering these questions. Send me a message. And so thank you so much for joining me today, and I look forward to seeing you next time.